the
prayer.
prayer to Patanjali. So come to the meditative state. Prayer brings the feeling of surrender to that Almighty, whether you call God, whether you call nature, whether you call the supreme power, whether you call the consciousness, or whether you call the Brahman. Slowly allow the body to flow with the breath. Breath is the instrument which connects body with the mind. And slowly breathe in. Yogena chittasya padena vacham malam sarirasya cha vedakena yopakarottam pravaram munina patanjalim pranjaliranatosmi avahu purushakaram shankhachakrasidharinam sahasra sirsam svetam pranamami patanjalim. Hari Om. Hari Om Tat Sat. Good evening, friends. As you know, we are here to see the interaction about the subject which we call the yoga therapy, that is the application of yoga from medical point of view. And as you know, we have conducted this course previously. We have one participant with us today, Deepa Prem. She has done the yoga therapist course. She is a yoga therapist, and interesting thing is she is based at Chennai. So the whole course she did online. But good thing about Deepa is she has not only done the yoga therapist courses with us, but also she attended a lot of other programs conducted by us, pregnancy workshop, and that was the entry. She came into contact with us, and then she did. And then on my recommendation, I recommend 100 people. We go to Shivananda Ashram. But out of the 100, sometime only one person goes. And that is Deepa Prem. On my recommendation, she visited Shivananda Ashram, stayed there for 15 days, experienced the ashram life. What is that? So I request Deepa to please share your experience of yoga therapy course and about working with us. I will make you on behalf. Yes.
Thank you, sir. Thank you for inviting me. It's always a pleasure to meet you, the Prana Yoga Therapy Center faculties, and Dr. Ghanshyamji has given me several opportunities. And that journey with the therapy center started with the pregnancy prenatal workshop with Dr. Preeti ji, and it was a holistic experience. I gained the confidence to teach pregnant women and to even to read the medical reports, clinical reports, and to find the medical conditions, individualized therapeutic aspect to deal with was given by her during the workshop. And followed that, I did the yoga therapist course level 6 conducted by Ayush with Dr. Ghanshyamji. And the anatomical, physiological aspects of the therapeutic part of the course was dealt with Dr. Ghanshyam sir and medical experts along with the yoga therapy experience. So we had live interactive sessions. It was the top of the cake. Like we have, we can deal with them regularly, and we can ask any doubts dealt with the anatomical, physiological questions, yogic physiological questions, applied yogic anatomy as well. And related to traditional yogic tests, so we had from the area of expertise of very challengeful and intellectual people from the scriptural part of the text were dealt with the different people. So we had a holistic experience throughout the 5 months of the journey. And during the end of the session, we had mock practical exams conducted by Dr. Ghanshyamji and the team. That mock practicals gave me a lot of confidence to attend the YCB board's practical exams. So it was definitely that experience. It is very much necessary. That confidence was given by the therapy center, and the recordings were sent then and then. So we were able to see the live sessions, so that we can recall. See, it is like going to a medical school. I felt that way. Each and every session was like going to a medical school. So the terminologies, when we keep repeatedly watching the live videos, we get the confidence to attend the yoga therapy level 6 exams. So this was the holistic experience. And after the course, I went to physical to get the physical benefits of the entire practice. I went to the Dhanvantri Ashram located at Neyyar Dam, Kerala. In the lush green atmosphere, I was able to relate Dr. Ghanshyamji's complete teachings over there at the Shivananda Ashram. I felt his presence there. It was a complete holistic experience. This journey, the complete journey started with prenatal and the therapeutic aspect, and then the Sivananda experience. It was a divine experience, I would say. It has to be done by all of you. And I definitely find that the therapy center will give a very good complete package of the complete course. They have several experts from different backgrounds and fields coming in and teaching for the therapy course. Thank you, sir. Thank you for the beautiful experience with you and Dr. Preeti and faculties of Prana Yoga Therapy.
Deepa, what are your current activities?
Yeah, I'm dealing with a lot of therapeutical benefits for spinal conditions like cervical spondylosis, ankylosing spondylosis, and women with fibroids and pregnancy related therapeutic benefits of a lot of women I'm dealing with. And I'm in touch with doctors and giving guidance for the patients. Mostly I have a lot of spinal conditions, people with more degenerative conditions of the spine.
Okay, Deepa, thank you. All best wishes for your future and do good work for yourself and for your patients. Thank you, Deepa.
Thank you, sir. Thank you so much.
Okay, coming back to today's talk, that is yoga biomechanics of yogic postures with anthropometry. We have a good faculty with us, Julie Dattani. She is a yoga therapist, level 6 YCB pass out. I had done lot of experience. She is a nutritionist. She is a yoga therapist. She has working in the field of yoga, I think, for last more than 10 years. A good experience. And we are happy to have you here, Julie. So with your experience, please share about yoga biomechanics and anthropometry sessions. You are she's already co-host, Erita?
Yes.
Okay, so you can start your slide presentation. Thank you.
Sir, I can't share. I don't have the option to share my screen.
Okay.
Or I have sent you, if possible, can you share the screen?
So you'll have to unmute.
Yeah.
Julie, you are already co-host. You can do that.
Yes, but I'm not getting the options. I'm just getting the same screen which is there.
No, share option is down, green.
Yeah, share option is there.
Then,
But I don't have option. I'm not getting the option to select what I have to share.
no, first open your presentation. Yeah, we can see you. But now your camera is visible.
Exactly.
Is your presentation open?
Just a minute. Yes. So good evening, everybody. I am.
Yeah, you are audible. The screen is visible. Go ahead.
Great. Yes. So just I would introduce myself just with little background of mine. As sir already introduced, I am Julie. I am in yoga since 6 years with Ketkar ma'am. My journey started with Ketkar ma'am herself and Gnosis Medical Yoga Therapy Center. I started with YCB coaching and conducting exams in Pune and lost many things since 2018. And then after that it was stopped because of COVID situations and all things online started. After that, all of a sudden I thought if I've already done so many things, I should move on giving my exam. So I appeared for my YCB yoga therapy exam. And in that, what new I found was biomechanics of yogic postures and anthropometry. This was something new which I found, and I found this is of my field, which have already been studied in my nutrition. So I thought I would take up this topic for today. This is the last topic. This is the last unit in our syllabus, which is called as assessment skills. Now, why is assessment required? The reason for assessment is you should understand where a person stands when a person has to start with yoga. So for that, we require assessment, and that is why I'm here to explain you what exactly assessment is and how this will help a person in their yoga journey. Now, what is biomechanics? Biomechanics is a study of the movement and structures of the body. The study of biomechanics in yogic posture considers how muscles, bones, and joints work together to create movements and shape. Bones, joints, muscle, ligaments, tendons, nerves, etc. play equally important role in biomechanics of human body. Now here when we say Patanjali Yoga Sutra, a very common and very nice sutra, Sirosukham Asana. When you are comfortable in that asana, then only you can enjoy that asana. This exactly is what biomechanics is saying. Okay, when you are comfortable in that asana, then only you can come to know the exact position where you are in that asana. Okay, so before moving forward, I would like to explain how many types of joints are there in our body. This is very, very important to understand. Understanding the types of joints is very, very, is my screen still being shared, right? Yeah. So before that, it's very, very important to understand how many types of joints are there in our body. There are 1, 2, 3, 4, 5, and 6 types of joints. One is the pivot joint, that is the joint of the neck. Then is the hinge joint, that is the joint of the elbow. The saddle joint, that is the joint in the fingers of the hand. The plain joint, that is the joint of the ankle. The ball and the socket joint, that is the joint in the hip. And the condylite joint, that is the joint of the wrist. Now we all know why joints. We talk about joints in yoga, asanas, and basically in yoga. We all know that we use joint movements to loosen the joints, and then only we can move forward and maintain the state or a proper, our body can function properly and we can be comfortable in the yogic posture. So understanding the joints is basically more important. Now let me tell you what is flexion and extension. Flexion describes a bending movement that decreases the angle between a segment and its proximal joint. In simple movement, when we bend forward, it is called flexion. And when we become straight, it is called extension. Extension is opposite of flexion, describing a straightening movement that increases the angle between body parts. This is very, very important for us to understand what we are doing when we are getting into a yogic posture. What exactly we are doing, we should understand that. So for a brief understanding, I've just put this slide over here. The next most important movement of our joints is adduction and abduction. With abduction, limbs are moved away from the body's midline, and with adduction, however, refers to moving your limbs closer to the midline. So when we take our legs or arms away from our body line, it is called abduction. Now, what are the joint movements? The movements that happen when we do a yogic postures is flexion, extension, lateral rotation, medial rotation, adduction, and abduction. What are the anatomical directions and the movements of planes? There are 3 planes. The frontal plane is the side bend chakrasana. When we do side movements, it is called, we are working on the frontal plane of our body. Sagittal is back bend. When we are doing backward bend, we are using this plane of our body, and transverse is the twisting posture. I have mentioned Kati Chakrasana over here. When we twist or when we move around, it is called the transverse plane, which we are working on our body when we are doing these yogic postures. Anatomical directions. In some postures like Pada Hastasana, we go towards the gravity. And in some postures, we are going against the gravity. When we are going against the gravity, the posture like Ustrasana or the posture which is the backward bend, in that we are going against the gravity. And in Pada Hastasana, we are going towards the gravity. All these things are important because for this, I'll move, if this concept is clear, I can move to the next slide, which is very important for our anthropometry, for our biomechanics definition. LOG, it is the line of gravity. This is very, very important in our study of yogic postures when we are studying specifically for a yoga therapy exam or for a further studies, we can say improvement in our studies, we can study LOG, which is the line of gravity. It is an imaginary line passing from the center of the gravity of an object down to the ground. You can see the line which is shown over here. This is not visible in our body, but this is a line which shows the line of gravity, which is called LOG. Then comes COG, which is the center of gravity. In human body, it is hypothetical point around which the force of gravity appears to act. At this point, the combined mass of body appears to be concentrated. Here you must have seen where the forward bend is shown. This is the point which is called the COG, that is the center of the gravity. BOS is the base of support. Very, very important when you are performing your yogic postures. This refers to the area beneath that includes every point of contact that the person makes with a supporting surface. This is important to find a person's ability to balance. You all must have seen when we are standing with 2 feet, with both the feet on the floor, when we are doing our normal postures like Tadasana, which I've mentioned in the further slide, when we are standing with both the feet on the floor, we usually in our class we teach, we have 3 pressure points in our feet, and when all those 3 are placed properly on the floor or on the ground or on the mat, then you can balance properly. As you tend to lose your balance specifically when you close your eyes. So this is very important to find a person's ability to balance, the base of support. The line of gravity passing through the center of gravity, which we just seen sometimes back, must fall within the base of the support in order for the person to stay balanced. We all must have seen when we are not in our yogic postures or when we are just in a leisure time or thinking of something or just talking with a friend, we tend to give more pressure on one leg and we tend to stand a bit slight bending on one side. But when we are doing a yogic postures, we always say, see that both our feet are placed firm on the floor and the balance is equally distributed on both the feet. This is what is called the base of support. And this is very, very important in yogic posture to maintain the balance, to enjoy the asana and be comfortable in the asana. Here I've given the example of base of support. This is increased in Tadasana because both the feet are firm on the floor, so it's easy to balance. When we come in Ekapad Pranamasana or Vrikshasana, which we commonly call, then it is a bit difficult to balance. We need to balance. We have to put in some efforts to balance because the base of support is bit changed. You can say misplaced or a bit changed. That is why I have shown the difference, which is of the base of support in this slide. Now, before I come to my next slide, I would like to explain the significance of biomechanics. Biomechanics, as I already said before sometime, is very, very important. To balance, to be comfortable, or to enjoy the asana. And we have all been doing this in so many years, but we were not aware that this is called biomechanics. Now there are biomechanics for different posture, for each and every muscle and each and every joint, and different types of postures. Like for bending forward postures, for bending backward postures, there is much detailed study of all these things in biomechanics. We would be learning that as we move forward in our course. So this was just a definition for all of you to understand what is biomechanics, because to me also this was a very new concept when I started learning for my yoga therapy exam. And when I started learning this, I came to know that these are the things which I knew, but I was not aware of this because I was not using this since so many days. So it is very common and very well known by everybody, and a very interesting topic for us to be comfortable in the asana and to enjoy the asana and to get the full benefits of the asana. Now moving forward to the next part of my topic, that is anthropometry. Again, this is very, very important for a yoga person. Now, why I would like to take this topic is anthropometry here is important because till date, like previously, it was like yoga was a common batch. Yoga was for fitness. People knew yoga for fitness. Nowadays, the scenario is, you can say, good or bad, but people come to yoga teachers or yoga instructors only after they come up with some disorders like pain hota hai, or if they are suffering from certain disorders like diabetes, hypertension, and when doctor suggests ki now you need to go for yoga, and then they come to yoga. So now somehow the scene is that yoga is somehow for disease and disorders. So even here we are happy, but for that we should understand the condition of the person. You can call it a patient or you can call the person. To understand the condition of the person, being into nutrition, this part again helps me a lot because there I had already learned what anthropometry was, and I could very nicely and easily correlate anthropometry with my yogic practice. When I came, and I was very happy to know that yes, yoga has come up with some things which I was really always wanting because it was necessary. Now, yoga is not common. We all know everything is tailor-made. Yoga is not common for everybody, which we have nowadays started learning. So your anthropometry would help you design a special yogic sequence for special type of people. The anthropometry is a scientific study of the measurements and proportions of the human body. Some people are healthy, some healthy as in some are hefty, some are overweight, some are underweight, some are obese. Some people have more muscle mass, some people have very less muscle mass. So if a person with less muscle mass is given too much of stretching asanas, that person won't be able to tolerate that. If a person with obesity is given the normal regular sequence, which 5 to 6 of asanas and more of pranayam, then it's not going to really help that person for what that person has approached to us. So from here, we anyways take a history of the patients, of the people who come to us. So these things will help us over here. We take a history, we'll take measurements of that person, of all these things, which would help us in two ways. One, it would help us to give a nice tailor-made sequence to that person, which would be more effective to that person in short period of time. And this will be with us for a record so that we can put the inputs every month or every 3 months or every 6 months and see the difference. And trust me, when the difference is seen on paper or when the difference is seen on numbers, it is more effective to the person and the person becomes more happy. The core elements of anthropometry are height, weight, head circumference, body mass index, body circumference, to assess the adiposity, that is the waist, hip, and the limbs, and the waist hip ratio, and the skin fold thickness. Now, there are different apparatus. I'll be explaining it further. There are different apparatus for different measurements. Some are common, everybody must be knowing it. Some are new, so I would just like to explain them here. Anthropometry provides a valuable assessment of nutritional status in children and adults. So the same thing what I said before, sometimes it would help us to see the visible difference. Now, the apparatus used to measure a few things of this. Weight, we all know, is a weighing scale. It is very, very common. Everybody of us must be getting on the weighing scale once in a day, once in a week, once in a month, or sometimes many times in a day. Height, we all know. When a person is asked your height, everybody knows your height in centimeters, in meters, in feet. We all know our height, and that's never been changing. Then the head circumference. It has been measured by a normal measuring tape. This doesn't give much difference when we talk about yogic postures or when we talk about starting yoga. This won't give you a much difference in that. Then comes the body mass index, that is the BMI, which is weight in kilograms divided by height in meters square. Nowadays, there are many techniques which are available. The BMI to measure, to calculate the BMI, it's very easy to measure BMI. We just need to put in whether the sex of whether it's a male or a female, and then the height in centimeters and our age, and it immediately gives us our BMI. It shows whether our BMI is normal or under, or we are overweight or we are obese. So the things have become very easy now. So to calculate BMI is also very easy. Then the body circumference, we use a normal measuring tape to measure the waist, the hip, and then from that we find out the waist hip ratio, and we have some normal values for that. According to that, we can come to know the person is overweight or obese. Sometimes the person is not obese, but the central obesity is there. That is, the person is obese, has more fat just around this area. And accordingly, we can decide what yogic postures or what yogic sequence we can give to that person. Skin fold thickness, which is being measured by a vernier caliper. We just hold the skin fat like this, and the vernier caliper is placed on this. And to find, again, from that, we can find out how much of fat is there around your arm circumference or the thighs. These are the two very common places where fat is being accumulated. So anthropometry would help us to measure, and as I said, to keep a record of this. Now, yes, when we talked about the physical things, let's talk about, as I've already mentioned, people nowadays coming to us with some disorders and disease. So yes, one more thing in anthropometry is the blood pressure, the pulse rate, and the body temperature. The apparatus used to measure the blood pressure is known as the sphygmomanometer, which I've shown over here. Yes, a stethoscope is also required for this. And this is a bit difficult to manage by a normal person. So nowadays there is something which is called a digital blood pressure monitoring apparatus, which has come, which is very common. This shows the pulse rate as well. And to measure the body temperature, we all know we use a thermometer. Now, blood pressure is being measured. There are some timing for the blood pressure. You can't measure the blood pressure anytime post asanas or pre asanas, or the person has entered your yoga center and you check the blood pressure and you find it fine. There are a few rules, there are a few timings, there are a few postures, positions in which we measure the blood pressure. All these things would be taught to you in detail in the course. So this was all about anthropometry and biomechanics. Now, the main thing, as I've already mentioned, the significance of all this was and is that we need to know where a person stands, so that accordingly we can plan a sequence, or we can plan nutrition. As nutrition is being added, I'm very thankful to YCB Yoga Certification Board, which has introduced nutrition in the yoga therapy course, which I always thought was very, very important for a person's health, to lose weight or gain weight or remain healthy or live a healthy lifestyle. So I'm very thankful that this part is being added, and for that anthropometry is also being added. So I think I've covered all the topics, all the parts which I wanted to explain. So over to you, sir. I would stop my screen share. Yes, sir.
Okay, thank you, Julie.
Thank you, sir.
See, both the topics from therapy point of view or a medical point of view are very, very important. Because when you move your body, your line of gravity changes, your base of support changes. Even when you do any balancing asanas, you can feel that. So therefore, this you should have a fair idea what is the body alignment. The concept of body alignment is based on the body biomechanics, and that is what Julie highlighted. Because every position, even when you stand, when you walk, when you run, your body biomechanics are changing. And if we have some knowledge about that, the body mechanics for a yoga teacher becomes a very, very important way for the assessment of the asanas when we are doing. And aging process is changing body biomechanics. When you walk in young age, you walk differently. When you become senior, you walk differently. That is all brings the concept of body biomechanics. Anthropometry is extremely important, very, very important. I remember sometime as a medical case record form when we used to fill in Kevalyadham, where I used to go as a medical yoga consultant. We used to measure the blood pressure, we used to measure the weight, and sometimes the patient used to come after 5 years, after 10 years. Then we used to say, before 10 years, your weight was 60 kg. Let us see now what is your weight. Now your weight is 70 kg. So 10 years per year, you have gained 1 kg of body weight. And that used to be very surprising for the student, for the patient. You see how good record they are maintaining. So this, the concept of anthropometry is very important. We should make a habit of measurement. And that is many times lacking in yoga teachers' assessment. You should know how to measure pulse. You should know how to measure BP instrument. And I don't advise electronic instrument, because electronic instrument, lot of variations are coming. So as a yoga teacher, you should have the speedometer, that is the BP apparatus. You should have, and you should also have the stethoscope. So the measurement of the BP, the measurement of the respiration, the measurement of the pulse, the measurement of the weight, hip waist ratio. All these things are play very clinically, play a very important role. And doctors are doing, but now doctors don't have time to measure all these things. So you can do that. And that is what we are going to teach in this course. Okay, what is the importance of this medical measurements? So with this, we will end up today's topic. For any inquiries, you can contact us. The numbers are given in the chat box. Tomorrow we have a very interesting session. Bhagavad Gita as a faculty. The faculty is Mugdha. She is going to deliver the session from Bangalore. She is based at Bangalore. So please join us tomorrow at 7:30. Thank you. Om Namah Shivaya. Good night. See you tomorrow at 7:30. Bye-bye. Thank you, Erika. Thank you, Julie. Thank you, Deepa, for joining the session.
Thank you, sir.
Thank you, sir.